Hey there, my name is Chinmay Patel. I'm one of the second-year emergency medicine residents at SIU. I think my entire interview process was pretty unique. It was my last interview day. It was in the middle of winter. I think it was early January or late January. And I actually got snowed in Chicago the night before my interview. Luckily, I caught the last flight out into Springfield. I remember landing in town in our airport and looking around a quiet, snow-filled city and was wondering what type of emergency program is going to be here. The entirety of my interview day was phenomenal. I got to see all the different hospital structures that we get to work through, the two ERs that we specifically get to spend our time in. And then I got an interview with Dr. McDowell. I think that was my most memorable experience. And I realized, Dr. McDowell is a very honest and open person. He's very enthusiastic, and he just exuded that during the interview day. And I found myself looking at as this is somebody I could work with. This is somebody I can trust to take me to where I want to be.
So the faculty at SIU, I think, are a big draw to the program, and is definitely one thing that really attracted me to the program to begin with. We have Dr. McDowell, who's our program director, and he's one of the most enthusiastic people. And one of the things I really like about Dr. McDowell is I feel like he is just as invested in your future and your career as you are. So he's trying to make this program the best it possibly can be. Yeah, definitely. I think our skills lab here at SIU is a great attribute to our program. We have a bunch of different models that we use to prepare ourselves for real-life trauma or real-life procedures that we'll do. I know just off the top of my head, we've done things like central lines and chest tubes and thoracotomies, things that are big, major procedures that would be terrifying to try your first time on an actual patient.
One of the best things about emergency medicine is we work with all specialties of medicine, and that's especially true during our residency training program. Looking at our training curriculum, we have a very robust off-service curriculum. We spend a total of 2 months of medical ICU at St. John's, 2 months of medical ICU at Memorial Medical Center, 2 months of trauma ICU, a month and a half of pediatric ICU. We spend time with the neurology service, a month with the OB service. We spent time with the anesthesia group, with plastics and orthopedics as well. And really, I think that speaks to the nature of our specialty. I was once told by a mentor that we need to know the first 30 minutes of every specialty, because that is what we do.
So being part of SIU and being part of the resident group is awesome. I love being part of the group. We have a very small program, but it's a very close-knit program. So between your class, I feel like you know your class very well. We get together constantly to hang out, to just relax, and either exchange stories or not talk about work at all. It's really fun to have somebody and to have a group who have the same experience as you and you can relate to completely and you can talk about whatever with.
So what I would tell any applicant that is looking at any emergency program in the nation is it's all about fit. Really, I know some people are looking for the program that's got the most heritage, the most lineage involved. Some people are looking for a place that has the best location. And really, at the end of the day, it really comes down to your fit. Don't limit yourself to one specific location. Don't limit yourself to one specific type of program.